Welcome to the Moulding Health Show. Our goal is to leverage the wisdom and experience of healthcare practitioners to set you on a path of self-discovery and healing. These insights, coupled with a multidisciplinary approach to each area of interest, should provide an invaluable resource to everyone looking for a better approach to health. In this episode of the show, we speak to Shelley Hall about postpartum depression from a clinical psychologist perspective. Shelley Hall, welcome to the show. So as I mentioned just before the show that you kind of are honorary guest now. Thanks very much for doing this and being on the show again.
Thanks so much, Oliver. It's really great to be back and sharing some new stuff.
So I know the last time we spoke about BWRT, but today we're talking about something really interesting, which is postpartum depression from a clinical psychologist perspective. And the reason I said interesting is because we had a social worker on, Sally Baker, and she spoke about birth trauma and brought up the depression aspects of that. And then we had Rueda Muller, a midwife, and she spoke a little bit about that as well. So I'm really interested to get a clinical psychologist view on it. So tell me firstly, well, just to kick it off, what is postpartum depression?
As I said, I'm going to bring some new stuff. So we actually don't call it that anymore.
Oh.
We call it perinatal distress, PND, and that's kind of an umbrella term for a couple of conditions that can happen. And I'm glad, as most psychologists or other professionals in this area are, that the name has changed. Because a lot of people will think post, we think post means after. So this depression only starts after. However, research has shown it actually starts during pregnancy. So a lot of this depression and starts during pregnancy, not after. So hence the name change.
Okay, that actually makes a lot of sense. Because one of my questions was actually going to ask you like postnatal. And, when we prepare for the show, we come up with all of these terms and, obviously I put it onto Google as well, see what people are searching for. And postpartum comes up a lot, postnatal. And one of the questions is actually, what's the difference between postpartum and postnatal? And I thought that's a valid question. And I wanted to ask Shelley when she got onto the show. So is that question kind of null and void now?
It kind of is. And even those terms, one, natal refers more to sort of the actual birth of the baby. But it's, yeah. So we rather speak about peripartum blues. And this would be probably 70% of women, that sort of first week after delivery and everything is just so overwhelming and you just can't cope with the smallest thing. But as things settle, you kind of get out of that. And then we will have more peripartum depression that lasts a lot longer after. Unfortunately, the layout is such in the diagnostic manual cuts it off a lot sooner. A lot of women do go on to experience it for a lot longer. But these sort of manuals and terms, they're always a work in progress. Thankfully, they do progress as our changing and experiences change.
Mm-hmm. Okay, that's pretty cool. I'm not gonna, if you don't know it offhand, it's cool. But is there like a diagnostic code for it? I know like almost all of these have it.
So it falls under your major depressive disorder.
Okay,
and then there's a modifier. So you would still use your F32, but the point, whatever, I'm not sure what the point would be, that would change. So you would have it as a modifier.
Okay, cool. Okay, that makes sense.
And while we're just talking about that, you would also distinguish if it's just depression or if there is psychosis.
Can you just go into that for anyone that doesn't know what that is?
So psychosis is really the other end of the spectrum. It is quite rare, and we think it's more with people who've experienced bipolar disorder or have that in their family. So this is somebody who would have a hallucination, a lot of confusion, and unfortunately quite often threatening towards the infant. So this might be the person that unfortunately might attempt to kill the baby. So it's very, very scary, but it's rare. Like 1 in 1,000 women, I think, is the stat that they have in the DSM. And it's most often within the first 4 weeks after delivery. And as you can hear, it's really, really intense. This is a case where we urgently get a bed in hospital and treat that mom as an inpatient.
Okay. So now I'm really curious. So how would you even know that? Would they normally talk about it? And that's how you would see, actually, they probably want to hurt the baby.
Yes, so, not to be disrespectful, but if we think of someone who's traditionally crazy, like you see in the movie, somebody who's talking to themselves and really agitated, maybe rocking backwards and forwards, or just staring blankly at the wall and saying odd things that don't make sense. So you would see it. It's a really, really intense condition.
Okay, cool. Over many episodes of doing the show, we've on, I think, close to 50 now, on just the Moulding Health one, and through the many episodes, and through the wisdom from the healthcare practitioners, I stopped trying to have these stereotypes, because lots of the stereotypes, the bubbles just got burst, for me.
Yes.
But I'm glad you said that, because I think, for me, if I saw someone doing that, that would just not be, it would be kind of weird. And but yeah, I like how you said that.
Yes.
Very cool.
And the depression can be a little bit more subtle. The depression, the person is still more in could we say, right state of mind. They're thinking a little bit more logically. So they would be better at hiding it. Whereas the psychosis, the person isn't. They're seeing, hearing things that are not there. So it's going to be far easier to spot.
Okay, cool. That makes sense. And whenever I think of that, I always think of the movie A Beautiful Mind. I've been thinking more about it now, because, the lead
Yes.
actress, plays in Top Gun now, which is out. And, I was just thinking about that, how he always sees these, hallucinations. And it must be very difficult for someone going through that, And I think with you and your profession, you definitely see it more, maybe not all the time now, but definitely in the psychiatric setting, seeing more of those type of patients here.
We do, and especially sort of if you're referring to Beautiful Mind, where somebody is able to hide it a lot more. Someone who is very, very intelligent can hide it because they can realize sometimes that it's not how it should be. And even with these moms with the depression, the mom has read all the books and she's got this expectation that she's supposed to be happy and joyful and excited and able to do it all. You've read the books, you've attended the classes, you can do it all. You should be the super mom. So they know how they should be or think they should be. And when they can't match that, they try to hide it from everybody. There's a lot of shame.
Mm, mm. Yeah, and even in my own mind, you hit it perfectly there, because you said, it's this whole joyous occasion, and everyone is so happy around you and so grateful and thankful that this, new bundle of joy is like in the world, and yet the mum is not feeling that, and that must be very, very difficult. The other thing I learned was the whole, concept of empathy, and trying to think of it from their perspective. It must be really hard, to put on that brave face and know you're not feeling it. That must be really rough.
It is. It's very difficult. I've got 2 children myself, so I know. And I think what we don't realize, we've got that 9 months to prepare. We watch our bellies growing and the body undergoing all these changes, but we don't really think about that the body's almost got to rewind, if you like. The body's got to lose all that weight, reset all those hormones. Everything's got to kind of rewind again. And that takes time, and that has a major impact on your mental health and also just not sleeping, of course, with that newborn. Major impact.
No, definitely. And I think I have a huge amount of respect for women that go through that, and I don't think men will be able to cope with that, to be honest, on a personal level. But it's amazing.
Well,
Sorry.
as you're saying that, it's actually some men do experience perinatal depression too.
Okay.
Very low, probably around 4% or something like that. But there are some men who go through it. Because it
Okay.
is, as you say, as a father, there's also these thoughts of, can I provide enough for this child? Can I look after this mother and this child? They're struggling, they're looking to me. And that can also cause depression.
Okay. And I think that did come up in the searches. Do men or do dads go through postpartum depression? But as you said, perinatal depression. So yeah, thanks for bringing that up. And is there something actually that can causes it? You can't profile people, but is there something around like the setup or the fact that maybe someone is more anxious? I saw anxiety linked, to postpartum depression. So I don't know if there's a link there. But why would some people go through it and others don't? Is there any link there?
Well, as you're saying, your body's got to rewind. So some of it can be the estrogen, progesterone, neurotransmitters, that sort of thing, resetting the thyroid. But if you've had all of that excluded, it's not due to that, then history is gold. We always look at what is someone bringing to the table. So if there's a family history of mental health problems, or if you've suffered from depression before, it's going to increase your chances. But then for me, in my experience, one of the biggest stumbling blocks is expectation. As you mentioned, that anxiety. Because moms read these books, they might hear from other women, this is what you should do, this is how you should do it, or social media, especially these days, exactly what it should look like. And then things don't go according to plan because your body hasn't read that book, nor has the baby, or seen those social media posts, and things happen. So then they feel that they can't cope because they haven't imagined it. So if we just go backwards a little bit here to neurology, to the brain, your brain works on a set of patterns. So if you're going to write your name, Oliver, you don't sit there going, oh, how do I make an O? How do I form the L? You simply write it. So when you are reading these books, listening to other people from early on, before you even think of having your own children, you're already forming a picture and a pattern in your brain of how it should be. So when you have a baby, that pattern is going to be triggered. And when something happens that doesn't match up to that pattern, the brain doesn't know what to do with that information. If you weren't expecting an emergency C-section, now what? Your brain's got no reference for it. It could push you into that depression. It just doesn't know what to do, how to cope. Or with that screaming, colicky baby. So it's quite complicated. There's a lot of stuff that goes into it. But my experience, it's when moms have been very, very anxious about the whole thing, and they have created this very specific birthing plan, and on the day it doesn't happen.
Yeah. The other thing I saw was, whether it's related to a C-section or, the type of birth, whether it's natural, does that make any difference to the postpartum depression? Do you have any thoughts around that? I mean, or is it just coincidental that certain people just have perinatal depression?
I think it can happen to anybody. It's not really about the type of birth. It's more what the mom had in mind.
Okay.
And it's often with breastfeeding as well. Some women feel really awful if they can't manage to breastfeed and they have to bottle feed. So it can be those little things that become big things down the line.
Yeah, we've got 2 children of our own as well. And you know what makes it worse is because I stayed over, those first 2 days or so, you can stay with the baby and mum. And you see the nurses do such an amazing job, with the baby, and it's not even theirs. And you realize how, especially the first one, you realize how untrained you are, with this. And I think depending on culture as well, especially with grandparents around, I think it probably makes it worse as well, because then you see the grandparents doing this amazing job, and you probably not. Yeah, so I love that word expectations, but I think it kind of summarizes everything, eh? Is that you have this expectation, and then the expectation doesn't happen, and then obviously there's that deficit or shortfall, and that's where the unhappiness seems to come in, or whatever else.
And of course, that's coupled with not sleeping and all the hormones resetting in your body, or if you're breastfeeding, trying to feed that baby. It's a lot.
Yeah. No, definitely. I mean, I think those first few months are actually very traumatic. I mean, when Sally spoke about it, the social worker, and she just said, sometimes it's it's pretty traumatic, the whole experience. I think Rueda mentioned the same thing. It's a she said in her mind, it seemed like a normal birth, but for the mom going through it, this was really traumatic, and she's like, this was really, it was really bad, and
Something foreign.
yeah.
You can read and you can listen as much as you like, but until you're actually in there. And I often find you think, well, you second time round, maybe you experience this as well. You think, well, it's the second time round, I know what to do now, I know what to expect now. And actually, it can be so different. And then you're back in that sort of overwhelmed state again.
Yeah, and I think also from coming back to the woman perspective, I think the body changes so much with each pregnancy. That's what we found with my wife. I mean, the body changes. Even the second pregnancy is different because your body has changed, the chemistry and all of those things. So interesting.
Yes, but older, all those things play a big role in it.
Exactly. Yeah. I mean, and I think it's a testament to how complicated human beings are, because everyone is different. I mean, there's no one secret formula that's going to apply for everyone. I think, you brought out expectations, genetics. I mean, I was going to say like upbringing, because maybe you have a certain expectation of what a mom should do, and when you find you can't swaddle that baby, as well as the nurse, I mean, that must be quite like unnerving. Do you find that as well? Anything around cultural or, upbringing?
Absolutely, absolutely. And I think often culture doesn't match up with how things are these days too. I see a lot of clients struggling with conflict over traditional ceremonies that they don't really want, no longer believe in, but the family still wants. And it just does put a lot of pressure. Or interracial, intercultural marriages can also play a huge role in that.
100%. I mean, I think that's pretty complicated. But as you said, and so I mean, I always try to bring this back from a into a tangible sense as well. I mean, the most obvious, like probably recipe would be just talk about it and figure out those expectations. But it's not as easy as that. When you put, as you said, like family, if it's an interracial relationship, different cultures, we don't really know that, and we just like kind of like stumble through it, and I think that must be, yeah, it must be difficult.
It's often with your more perfectionistic type. Your
Mm,
person that likes to have a plan, likes to have, we call it scenario analyzing, gone through different scenarios to feel that they have some sort of control. And that's usually where things can really fall down. It's this
okay.
belief that we can talk through it, we can talk to lots of people, we can read all the books, we can have lots of plans ready, we can have some sense of control.
Mm, yeah.
But we know life can give us such surprises.
Yeah, but as you said that, I'm thinking, a pregnancy by, by its nature already has this plan around it, because like there's a definite time frame, that it's going to happen, and everything, like everyone around you keeps on putting these time frames on. You have to do this by then, like you have to go to these gynae visits, you have to, I don't know, get the nursery done by a certain time. So it's almost like if someone is not that planning type person, that must be crazy. Or it must be really difficult.
Yeah, I guess if you're more relaxed though, then you're probably like, oh, okay, yes, I know I must have that done then, and you'll do it at your own speed. Those people are less likely to suffer from depression, in my opinion. But I think it's more the ones that, okay, what must I do next now? When is my next scan? And they want to have it all so perfectly laid out. They tend to run into trouble with this.
Okay, cool. That makes sense. I mean, so the one question I asked, I think I asked the midwife, Rueda. So if someone is already undergoing or has depression, so like they're already on anti-anxiety meds, and I know this is out of scope for you, because normally that's like psychiatrist has to prescribe. But do you find anything around that? I mean, how did they cope through the pregnancy? If they're already on like depression related meds, do they have to come off the meds? Like,
I think it depends on severity and the type of meds. Preferably, people would be willing to off the medication, come off it completely for the pregnancy, and then go back on. But it's something that would have to be really carefully managed with the doctor.
okay.
And that's where I, as a psychologist, would prefer the therapy side, especially as we've spoken about in the other episode, brain working recursive therapy,
Hmm.
that can change things very, very quickly without the meds. But
Okay.
it is something that you'd need to really discuss very carefully with the doctor and have some resources and things in place to manage that anxiety or that depression if it does become, because 9 months is a long time.
No, definitely. So I think you brought out the magic theme now. So in terms of, how do you help from a clinical psychologist perspective? So would someone normally seek out your help during pregnancy, or would it be after that? I mean, I'm assuming it's a bit of both, obviously, but do they? How would you help them as a clinical psychologist?
I think sadly, a lot of people are only referred after the birth once they're in trouble as such.
Okay.
And I'm not too sure why it happens exactly. I think a lot of people prefer quick fixes, pills or something like that. Or maybe doctors aren't referring enough, or too expensive, whatever the reason. So it would be best if somebody came in the beginning, when they first find they're falling pregnant or they're planning to fall pregnant, so we can start talking through some of these things, especially if they do know they have an existing condition and they're needing to go off their meds. And it's chatting through, as you're saying, talking, understanding that babies don't read the books, for example, that there are so many things that can happen, and trying to help the person create more flexibility in their sense of control and their sense of thinking would be a big thing for me. And there are like a lot of online resources. I don't know if you've heard of a group called Mum Support.
That sounds pretty good.
Yeah, it's an amazing group. It's www.mumsupport.co.za.
Okay.
And they've got face-to-face groups, WhatsApp groups, coffee mornings, all sorts of places where new moms or moms-to-be can just connect. But for me, that's one of the most important. Yeah. And it's also looking into somebody's history. As I was saying to you earlier, history is gold. When a client comes to me, patients always go, oh, why do you want to know about our childhood? But we do, because that's right where your brain starts forming all of its patterns of survival, its ways of responding to the world. So history. I like to get a really, really good history to try and understand where pitfalls might be for this person. And if you've got traumas that you haven't resolved, it's also something that can trigger this kind of depression later on.
Okay, that sounds really good. So if someone was referred or they did come through and they said, like, I really need help right now and I'm going through this, I mean, is there a certain process that you take them through? I mean, is there a certain amount of time that it takes, or is that just the start of their therapy journey if they haven't been in therapy before?
It depends. If it's very obvious, if they're very obvious things like a death or something like that we could target, that might be it. It might just be one session, especially if we're using BWRT. Otherwise, it would be trying to identify, is it more around the person's thinking? Is it more trauma events that we need to target? And we would come up in the first maybe 1 to 3 sessions an actual plan. Like I say, just depending how much there is, how much has happened.
Okay, that sounds pretty cool.
Hope that answers.
Yeah, no, it does. The other one that kind of came up, and I don't know if this is relevant, is they ask for symptoms. I mean, like, so, like, are there certain ways that someone presents, when they have perinatal depression or postpartum depression?
Yes, there are. And there are also some questionnaires that one could use, but I can go through some of them. So one that's obvious is frequent crying, that sort of weepiness, just absolutely anything sets you off. Insomnia, unable to sleep, not because of waking up for the baby, but even when the baby's down, you still just can't get to sleep. Or hypersomnia, even though you do get some rest, you just still feel absolutely tired. You just want to sleep all the time. Exhaustion, fatigue, low energy, changes in appetites, and someone starting to neglect their personal grooming. This is quite a big one. Just even when you do have someone to look after the baby, the lady's still not taking a shower or ever brushing her hair, just sort of loses all interest in how she looks. Loss of enjoyment, just even though that baby's screaming all the time, most of us can, when the baby's finally asleep, go, oh, but look how precious she is. Looks so sweet when they're sleeping like that. Some sort of pleasure in it, but that person is just absolutely nothing. They just can't find anything to be happy about. Increased anxiety, trouble connecting with that baby. I know that baby's mine, but it just doesn't feel like it. I know I gave birth to it, I carried it for 9 months, but it's just over there. I just can't get that connection. Panic attacks, feeling overwhelmed or just can't cope with things from day to day, basic things, just getting up, like we said, in the morning, brushing your teeth, brushing your hair, making a cup of, just unable to, just wanting to lie in the bed and do nothing. And then this is quite an important one, is listening for that voice. What is the person's self-talk like? That self-criticism. As you were saying earlier, like comparing, oh, my mom can do it much better, your mom can do it much better than I can. You can hold the baby better. Rather you burp the baby, I'm not holding this baby well. So what is that person's inner voice like? And then constant sadness, worthlessness, hopelessness, guilt. Guilt's a really nasty one. Concentration problems, confusion, not quite knowing what day or time it is, mixing things up. That's a serious one. I think you can hear some of those psychotic aspects.
Mm.
And a massive one is thoughts of harming self or the baby.
Okay. And I have to ask, I mean, so when you say this, is it over a prolonged time or is it like a few days? Because I mean, I would think, some of those things, obviously, I mean, like when the baby's born and that first week, that's chaotic. And I suppose there'll be some of those.
Yes.
But I'm assuming like it goes on for a few weeks and people around them can actually notice that this is happening. Is that right?
Yes, so we might expect this. I think something like 70% of women, quite high, would experience this in the first week after delivery, while everything's resetting. But usually they would get some support, a bit of sleep, and everything goes back to more or less normal after about a week. And then, but if it continues, so if it's going on for now 2 weeks and you're seeing that symptoms are getting worse, it's really persisting, that's when we get worried. That's when we need some professional help.
Okay, cool. And the other one I want to ask is, this almost implies that people around the person has to be a lot more aware. And I think, and this is where, I think doing the molding shows, for me is amazing, is because I think like, it's almost like, when you get your pregnancy pack, you need to almost like get a pack from Shelley Hall saying, like, please be aware that, like perinatal depression is a reality, like, and like these are the things to be aware of, because I think most of us, like, we don't know that stuff, like, I've learned so much just by, like speaking to people like yourself, but there's something about that. Do you see the same, or do you find people a lot more knowledgeable about this stuff?
I know, absolutely. I see the same. And it's especially for that mum who is trying to hide it away because she wants to be super mum. Everyone else seems to manage all around her and she should be the same, but she's not. And I can even remember after my second daughter, I was helping at a school at the time, we're living out the country, phoning my friend and saying, I just can't do this, I can't manage, she just wants to feed all the time, and it wasn't like this with my first daughter. You probably don't even want me back at the school, I'm just so alone. And she just said, Shelley, get in your car, pack the baby, just come back, just come see faces. And that's what we need. We need people that are checking in on us and actually saying, you know what, it's okay. It's okay. Even if you have done this before, even if this is your fourth baby, it's actually okay. And that's what we really need, is to bring awareness and have people checking in on us, normalizing this stuff.
That's such a, I love what you said about the second baby, because I know a family friend, and their first pregnancy went so amazing, and the baby slept through the night. It's one of those, like those stories where you hate the person when they tell you that. And the second baby was completely different. The complete opposite of that first experience. And so yeah, you're right. I mean, like, no pregnancy is exactly the same, even from the same mom. I mean, like, which was interesting. Okay, I love
and
that.
also that stat is quite important. I think it's 1 in 3 women in South Africa suffer with these PND conditions. Okay. 1 in 3. So wow. You're not alone. Lots and lots of women.
I went for every gynae visit during the pregnancies. Well, maybe my wife would disagree. I think she reminds me I missed 1 or 2 due to meetings. But like, I can't remember the gynecologist telling us at any point that this is something you need to be aware of. It's like always about, everything's going to be okay. The baby's going to be born, check the heartbeat, it's a boy or girl. But I can't remember anyone, like pointing and saying, actually, just be aware, this stuff can come up, maybe speak to someone from a counseling perspective or whatever that is. So it's almost like I don't know if that comes up. We didn't do the classes, like I think you get these pregnancy classes. I don't know if they mention it there, maybe, but
I think that is it. If I could have it my way, I would probably mandate every couple just to go for at least 1 session with a psychologist or a registered counselor, just 1 session, just to chat through these things. Because it's not. I suppose the doctor is so focused on giving you a healthy baby,
Mm,
on the medical aspects, that this can fall away. And it's interesting because I have had clients say to me they have thought those last few scans, especially when they felt that something's going wrong, that the husband wasn't in the room. The husband wasn't there. And when they've said it out loud, the husband has gone, but actually we were, and your parents were just outside the door. But that woman has felt so alone in that moment because she's just so overwhelmed with everything that these doctors are saying could happen, and it just becomes too much that she literally in her mind almost blacks out the others that are there.
that's so
So it's quite
interesting.
important to realize that.
That is pretty profound, actually. I mean, I don't realize that, but as you even saying that, what I'm thinking of is like almost like stage fright. It's like, when because everything is about the woman at that point, right? All of these people around, even the family. But if you're the type of person that probably doesn't want that, you don't want to be that center of attention, that can be quite unnerving and creating that blackout kind of moments as well.
Yeah.
Yeah.
And women are bad at asking for help.
I think
We are
people are
quite
bad.
bad. I don't know if it's the Disney movies, if we should blame those. They always have this prince who knows exactly what this princess wants.
Yeah.
But we're quite bad at it. So if you ask your lady, is it okay if I go get a cup of coffee? I'm just going to go work over there for a few hours. I'll be back. Are you okay with that? She's probably going to say yes. But you should
Yeah.
probably ask a few more questions and take that as a no.
Okay. Okay.
It's so much easier just to think, oh, I'm in this alone with this baby. I mustn't put too much pressure on him. He doesn't really know what this is like. This has come from my body. Let me try and deal with it myself.
Mm. Okay, now I feel guilty because I think that would have been my modus of operandi as well. It's almost like you pull up the laptop, and you just start working, and I think that's a kind of shut off. Then you're not connected in the moment, and yeah, I think anyone that's in that same boat, men especially, I suppose, it makes sense though. Not even just going away, but even if you're in that moment, but you're not fully connected or in that moment, that's probably an issue.
Such
Um,
a great word, connected,
mm,
to ensure that you are connected, that your lady isn't feeling totally alone.
mm. Yeah, and now we have obviously the whole mindfulness movement, or like talking about a lot. People are kind of getting that idea that actually you can't do more than one thing at the same time, and still say you're doing like just one thing. I mean, I think that's the whole thing. You have to be
Yes.
in that moment and doing it. Um,
There is no such thing as multitasking. That multitasking is a fallacy.
yeah, and
Our brains can only manage one thing at a time.
yeah, I don't know if it's me as well, Shelley, in terms of age group, but there was a time, and I think it was probably the 2000s or maybe 90s or something. But multitasking was cool. Like when you would tell people you're multitasking, it's like, wow, that's amazing. Teach me how to do that. And now we kind of gone like full circle, and it's like actually multitasking is bad. Even computers don't multitask, and they only do one thing at a time, but they do it so quickly that you don't see it as them doing one thing. So yeah, interesting. Do you
Yeah,
find that as
yeah, it
well?
was. Yes, I think it was a really big reinforced, and still is a massively reinforced idea that we should be able to multitask. And yeah, as you said, it just doesn't. Even computers can't do it. It really is a horrible fallacy that we need to get rid of.
Yeah. It becomes actual horror stories when you see people with their phones out, busy texting, while driving. It was like, no, I don't think multitasking works like that. Yeah.
No. Or pretending to listen to their partner while they're at dinner or their kids. No.
No, yeah, it's true. Yeah, I mean, I think it's always a status check for all of us. I mean, irrespective of we're talking about obviously perinatal depression, but lots of these things for me, it comes back to like just the basics. If you just get the basics right of being in the moment, you get the basics right of just communicating, talking about expectations and all of those kind of things, we make it easier. But we just don't do the basics, and then we end up with like major issues. Um,
Yeah, no, it's so true. So, so true. It's just sticking to the basics and ensuring it's good housekeeping, really. If you are having a baby with someone, you must ensure that that communication is there. If you are going to become a parent, you have to ensure that you've done your housekeeping, you've cleared those old traumas, you've got your health checks in place, all of those sort of things. You have to have those done. You know,
Yeah.
people, even with children, people will say, why is my child acting in this manner? They're so angry, they do X, Y, Z. And it's often because that's what they're seeing, that's what they've been taught. So, how you would like your child to be, you need to first ready that within yourself.
Mm. That is pretty amazing as well. I mean, I think, and more in terms of what you said, and I think, I'm a huge believer in this now, is that I think we need more of that intervention before we think we need the intervention, and it's like having that, like we do this for marriage for some reason. It's a new thing now, but pre-marriage counseling, but we don't have pre-birth counseling. Like, it's probably a new term, but that would be amazing. um
Yeah, kind of like doing your learner's license before you go
yeah.
for your driver's,
you know
before
I
you
think
get
this
a
is
car.
way more important. Yeah. No, definitely.
Yeah.
And I mean, I think when we were having the first child, and I went and read all of these books on parenting and stuff like that. But I promise you, when Kiara came along, it was, yeah, all of those things didn't make any sense. It was like you in the moment and you doing stuff. It didn't,
Yes.
some things kind of resonated, but for the large part, you were just doing stuff and making it happen.
I always enjoy when I have parents, I pretend to open my desk drawer and pull out this very heavy book and go, here's the manual, this is the manual, this is exactly what you must do and not do. And there isn't.
Hmm.
You know, it's obviously I'm not talking about extremes, but most of the time there isn't really a right way or a wrong way of doing these things.
Hmm.
Most of the time, the things that we think we should just do, go with naturally, are okay.
Hmm.
But we start judging, we start letting this horrible little inner voice come in, for whether it's from social media, especially these days, or parents. We let that outside critic come in and really rip things apart instead of trusting our own inner gut.
Hmm. Yeah. And I think the other thing is, and we're talking about, obviously depression and, people that are quite unwell sometimes. I think the smallest thing that you don't realize how those words hurt, maybe, and maybe even if you didn't mean it, but when the other person is feeling that, it's like those things could cut, really badly. And I think that's the thing, is sometimes just life and not being conscious of those things,
Yes.
it could really derail, people. Um,
And I think it's a massive thing as well. Something we haven't really touched on is if someone is suffering with one of these PNDs, one of these disorders, we have to change how we are managing them, how we are responding to them. That this person isn't just going to snap out of it. They actually have a major depression or a psychosis. And we've got to change how we are looking after them and that baby. It's not the same. A
hmm,
lot of people, unfortunately, don't believe in depression or mental illnesses. I'm sure you've discussed in other episodes, and they just think, oh, this woman must just get over it. People have babies every day. You know, what's
hmm,
her issue? Just snap out of it. But
hmm,
it doesn't work like that. They really do need treatments.
hmm. Yeah. Uh, when you were saying that, I'm thinking of another angle that we probably didn't cover as yet. There's so much of attention on the baby, especially after the baby's born. So it now shifts from the mum to the baby. Is there any dynamic around that? Because I mean, that can't be, because everyone's like, everything about the baby. I mean, that, for the mum that just kind of went through this whole ordeal and, experience, that must be quite unnerving as well, especially in those first few
Definitely.
weeks.
And you know, that will feed into your depression as well. That again, that whole thing of feeling unsupported. Often breastfeeding mums prefer to go and feed in the bedroom, or it takes time to put that baby down. So everyone else is outside having a wonderful braai, whatever they're doing, and this lady's isolated on her own, trying to get this child that won't stop screaming to sleep or to feed. And no one thinks to bring her something to drink or something to eat.
Mm.
So it's just this whole theme of being abandoned, unsupported.
Mm. Yeah, I mean, I just thought of that just now, and the other one as well is like your own expectation of maybe how the baby should be. But if you have this screaming baby, I mean, I know there was a few embarrassed moments, when you can't get the baby to soothe, and sometimes it's like putting them up or swaddling or whatever, getting to that magic position, and that that creates its own like trauma and like
Yeah,
yeah,
it
anxiety.
does. And it's awful, that little thing's screaming and you don't know why. As you say, you're trying it this way, that way, just about upside down. Where's this magic position that everyone talks about? And sometimes they just won't.
Mm,
And that can be very distressing and overwhelming. So you
mm,
feel like you want to just throw that baby out the window, whatever it is, or run away.
mm,
It's hectic.
mm.
Luckily, not all babies are like that. So I believe some people have magic babies. I never had that experience.
Yeah,
Just
I've
speak through
heard
that.
those.
But
I've heard those.
it's to recognize when you are getting overwhelmed and frustrated before you throw the baby out the window. I'm saying it
Mm,
lightly here, but I don't mean it lightly at all.
mm,
To actually get that help and to see it in your partner,
mm,
to actually take the steps to get your partner that help, not to say, oh, do you think, to actually go in and say, oh, let me take the baby. You go and get a cup of tea or have a shower. I'll take over for a few minutes. If
mm.
anything goes really wrong, we'll come and call you, but you have a break.
Yeah, no, that's amazing. I mean, I think that's what Sally mentioned as well. The social worker. She just said, almost like giving mums a break. Sometimes it's as simple as just saying, can I do the shopping for you? Can I, just take you a home cooked meal? Like the simple.
Yes.
Again, it's the simple things, but you don't
Yes.
really think about that. It's like, yeah, and maybe
And
also
it's even more
taking.
challenging. Sorry.
No, no, go for it.
I was gonna- Even more challenging when there are other children. We sort of talking if there's just one child, but when there's more than one child, then there's several duties that need to be performed. And if you've had a C-section with other children to still look after, that can be a massive thing too. So it is, as you say, thinking about what does the mom need, what would the mom benefit from, not just the baby.
Yeah, the point I was going to say is like maybe taking the baby out of earshot as well, because it's always like weird. Like you can still hear the baby crying in the background, and yeah, yeah, and that can't be good as well.
No.
Um, what about triplets and quadruplets? And I mean, I can't imagine how a child, like a parent would or a mom would go through that. I mean, I remember the one time visiting. I don't think it was a family member, but maybe friends. And the mom had a one baby. The one baby was in the cot. The gran had one baby, and the husband had one baby. And I'm like thinking, how do you do that? Have you found any experiences around that?
Certainly, yes. I think everybody wishes they were like an octopus. They just had extra arms. Just is very, very challenging. Often those little babies will kind of soothe each other. They enjoy each other's presence, but it really does then take a village.
That's amazing. Yeah, I mean that's. I just think with one it was pretty difficult. I can't imagine with two or three at the same time. I mean, it must be pretty hectic.
No, must
Um,
be.
Something else we kind of came up with when I was researching the topic was, people were asking for, are there natural ways to deal with postpartum depression or perinatal depression? I mean, are there things that people should just be? I know we mentioned mindfulness now. Meditation always comes into the mix. Diet and stuff like that. Have you found anything around that people can almost like at least get the basics right?
I think you can. There's a lot of alternatives these days. I'm a big fan of aromatherapy oils. You get those beautiful little diffusers that you put a few drops into and it
Hmm.
fills the room. Got to be really, really careful though. There's some that you've got to, yeah, got to know what you're doing. Don't want
Okay.
to put too much in the room either. But for me, it is always some preparation as well. Kind of knowing, if you think of it in terms of energy. So if your energy is, my one for anger and for excitement would be red, having something prepared or more than one thing prepared that could calm you. So whether it's a beautiful photo on your phone that you could look at, concentrate on, notice all the colors, the patterns, or a favorite smell like lavender that could calm you down, something like that prepared ahead of time. Or if you are feeling really, really sad, having some energizing activities prepared, that you could do 10 jumping jacks, or you could play your favorite lively, uplifting song. Then your homeopaths will have a variety of medications as well. And I always do call them medications. I'm tired of people saying it's natural, so it's harmless.
Hmm.
Nothing is truly harmless. There are always consequences. We need to be careful with those things too. Yeah. And then, of course, your therapy. Therapies are, for me, the ultimate. I know I'm biased as a psychologist, but therapies, knowing where the issues are, where your triggers are, and getting help on those ones.
No, you're so justified to be, like biased around that. I mean, I'm a firm believer that I think if we had more psychologists and more counselors around, I think the world will be a better place. Because I mean, I still believe that you can't see your own like nonsense. You need someone to point it out, and unfortunately, everyone around us, kind of ratifies what you do. So it's the wrong people, that you ask for
Yes.
opinions. So you need someone completely unbiased, to look in the mirror.
Yeah.
So that's the space.
It's because your brain only goes with what's safe. So even if you don't like doing something, because the brain knows that has allowed you to survive, it's going to keep you doing that. And then it becomes more interesting as you're going to subconsciously, of course, select people who keep those beliefs going, who allow you to keep playing out the same patterns.
I like how you said that, and I was thinking about it earlier, like on another question or so when we were talking. But you know what? The other thing I learned a lot in by especially psychologists, or in the show, was the whole conscious, unconscious, and subconscious. And I think the
Yes.
one, it was a clinical psychologist as well, Jeannie Covey. She said, like to commit suicide, the easiest would be just to stop breathing, but your body would not allow you to do that. Your unconscious would not allow you. And I think if we can start moving more from conscious to unconscious or subconscious, I mean, that would be amazing, eh? But as you said, we're stuck in these patterns. We just keep on doing the same nonsense over and over and finding people that can validate that for us. But that's why, and that's where I said,
Yes.
you're justified with the psychologist perspective or the therapy perspective, because we need that, and I think, it should be part of
Yeah.
school, like OT, we should be going through that. That's what, we should be getting like sessions on.
Well, you also have to be in the right space for it. Your
That's true.
subconscious has to be ready to reveal these things and allow you to work on them. But it would be wonderful if it was more accessible and accepted. That would be amazing.
Maybe off topic, are you finding there's a lot more acceptance? I mean, like, from a psychology perspective in society, or are you finding it still, pretty, I'm not going to say fringe because that's not true, but definitely a lot more accepted?
I think it's still pretty much the same. I think it might be why we're seeing a lot more coaches popping up, because it sounds a lot better to say I'm going to see a coach than a psychologist to our society. So I don't think it has changed entirely. Yeah, I'm still having a lot of people coming, and whatever the race group is, they'll sit down and say, in my race, we don't believe in psychologists. And I've had that with all the different race groups. So I think there's still very much a stigma there, unfortunately.
Yeah, I mean, I smile because we do another show as well. It's called Moulding Lives. And I normally try to have like more entrepreneurs, like non-healthcare related. And we had an author on recently, and her name is Tando Pato, and she released a book about how she overcame alcohol abuse, and and she was just saying, in the Black community, you always go to speak to your preacher, like it's, or your pastor, like you never go see a psychologist, and how seeing a psychologist actually helped her so much, to get through that. And I thought that was quite refreshing because it was exactly, the same. The other sad thing I've seen recently is that some of these, like the health insurance companies, the like life insurance.
We won't mention names.
Yeah, yeah, definitely not mention names, but if you go see a psychologist, they don't see that as a wellness thing. They don't see that as a, like just getting better. They see that as a bad thing. And I think with
Yes.
COVID and stuff like that, I mean, that can't be good. I mean, we changed policies recently, and like the fact that you go see a psychologist is like, okay, why are you seeing the psychologist? Why are you seeing a physio? And this whole like proactive wellness thing, doesn't seem to be, even recognized by those type of institutions. And I think that's pretty sad.
It is. It is. It's a major, yeah, it's quite a massive thing, because there's something called prescribed minimum benefits, PMB. And that's legislated that for mood disorders, schizophrenia, or acute stress disorder, the medical aid is supposed to fund 15 sessions for the year in hospital or out of hospital. And I think I've seen it happening a couple of times where it's then diagnosed, not explained to the patient. Patient wants to change medical aid or wants to take out a life insurance. Now, because of that diagnosis, especially if it's a bipolar diagnosis, you've got this big mess. Mm-hmm. And sometimes it's a simple case of they want you to get a psychologist to fill in some more questionnaires or write a letter to say that you've done your time in therapy and you're now fine. And other times it's not. It can lead to serious exclusions or hiked prices. Mm. So it's quite sad that it is, like you say, a punishment almost for seeking help.
I'm glad you collaborated that, because that's exactly what we, started seeing with some of our clients as well. Is that a lot more requests, for those type of motivations or justifications, like as to, especially when you're changing policies, I suppose. Interesting. I know we have to wrap up soon, but I have to ask, based on COVID and the last few years, have you seen any correlation between postpartum or perinatal depression and the pandemic?
I think there has been a little bit more of an increase. It's kind of hard to say, but I think there has probably been a bit more of an increase, especially during COVID, where people were not allowed to see their babies or they were separated from their spouses. It was far more rigid. That definitely increased anxiety, especially, more than anything, I would say.
Okay, cool. I'm glad. Well, I'm glad to ask that. And you never know, so I've made it a point just to ask the question, because some of the responses have been interesting as well. The midwife, as an example, mentioned that, for a long time, like, babies didn't see faces. Like, you didn't see, yes. Especially with other people, not the mums and dads. And they kind of like assumed that, so they didn't know how to smile. And I thought that was interesting, hey? Like, the whole impact of COVID, and the babies were a lot more clingier, to their parents, because obviously, you don't have play dates anymore and stuff like that. But
I think it's made us more fearful in general. I was in Woolworths yesterday and somebody started coughing in the line, and I found myself rapidly whipping up my mask, and I looked behind me and everybody was rapidly putting their masks back on. And I see some play therapy. The kids, they'll make like little masks for the Barbies or for the dolls. Yeah. So I think it's eventually going to reset, but it's going to take us all some time to actually start feeling safe again. It's definitely planted the seed that we're actually not safe on this planet.
Yeah, I think for everyone that had, like the germaphobes, I mean, the last few years have been probably amazing for them, as in they said, see, I told you so, as, you need to be like this. But yeah, you're completely right. I mean, in the last week as well, going to the shops, and I went to go get like an ID card done, and almost no one was wearing their masks except for the, the consultants. And I thought that's interesting. And, but yeah, very interesting world, but I think you
next time give it
cool. Let's wrap up there.
I was going to say, next time give a big sneeze. You'll see everybody rapidly finding masks.
I love your sense of humor.
We've got a delay.
Yeah, that'll be funny. I want to ask one last question. Anything around this topic, because I tried to cover everything that we thought we should research, but anything around postpartum or perinatal depression that you thought I should have asked you, but I didn't?
I think we've covered everything, and it's just to drive home that point that it's not a bad idea to maybe seek just one professional session with your partner to really, really lay out expectations and finding how best to support one another. Never mind that baby throughout that process.
Thanks. Yeah, I think that's the biggest thing I picked out of this. And yeah, so I mean, I think, even if it's more like advocacy to like gynecologists or doctors, just saying, just mention it, just mention like how you do premarital counseling, pre-pregnancy counseling or pre-birth counseling or something. But that sounds amazing. Thanks very much for doing this. We're really, really glad to have you on the show again. So yeah, thanks for doing it.
Thanks very much, Oliver. It was great to be on the show again.
Hey everyone, thanks for listening. As always, Stay tuned, and we'll speak to you in the next episode.